The thing that you need to realise with orthopaedic surgery is it's not like other realms of surgery where you're just unblocking a tube or replacing a tube. There's a voluntary contribution to how well you can do both with and without surgery. And that's what we've generally been very poor at measuring and understanding in orthopaedics. So in other words, there's a patient contribution and there's a surgical contribution. If you're a patient, you want to know, how well can I do without surgery? Do I actually need this operation? How best can I prepare for it? And how do I measure my success afterwards? We've adapted some techniques from professional cycling. Obviously cycling is a closed chain exercise, it's very measurable. And with elite cycling, we've actually been using what they use to measure outcomes and performance and intervention. So we have something called an info crank, which is an Australian designed torque meter that's built into the crank of the bicycle. It gives incredibly detailed analysis of your pedaling strength, your dynamic assessment, and your strength of left and right combined. We're just embarking on a wonderfully interesting process of using this now in our research, which is really been fantastically interesting, and I think will take me the rest of my career to work out. But I think it holds great benefit to patients and to surgeons alike to know the answer to those questions in more detail. Who needs an operation? When do they need it? And how do we measure how well you're doing after surgery? Some operations are performed too frequently. Some things do get better by themselves. There's probably over-operation. We probably over-operate in some areas. I think most people would want to know how good they could get without surgery. I think that's a very reasonable thing to ask.